welcome to the third video in our Praxis Q&A series. In this series, we demystify the process of studying for the Praxis by exploring specific topics that you'll be required to know come test day. We'll be doing this by examining questions from our program that challenge your knowledge and understanding of Praxis topics. In the first video, we talked about the recall and application questions that appear on the Praxis and why some Praxis topics might seem more challenging than others. We also explored questions from the Praxis content category, Foundations and Professional Practice, which focused on language development. In the second video, we explored additional topics from Foundations and Professional Practice, including questions about characteristics of common communication and swallowing disorders, factors that influence communication, feeding, and swallowing, and ethics. But today we'll focus on topics from the screening, assessment, evaluation, and diagnosis Praxis content category. The topics in this category include screening, approaches to assessment and evaluation, assessment procedures and assessment, and etiology. Questions from this content category cover the range of disorders that SLP treat, including all communication disorders and feeding and swallowing disorders. We've provided the first question on the screen. Can you tell first a little bit more about yourself and then more about this question?
All right, so looking at this question, we have an application question about the voice. So the correct answer is C, myasthenia gravis. So when we're looking at this question, what we need to kind of, be prepared for, especially with the Praxis, it's kind of these long questions. These questions that have a lot of information, a lot of different information. You may have to read and digest a lot of information in one scenario. So an effective strategy for starting out with this question is to read the last sentence of the question. So what are we actually looking for before we start reading the question? So the last sentence in this question, the case information is most consistent with which of the following diagnoses. So now we know we're looking for the correct diagnosis. We're not interested in what treatment planning, we're not interested, in maybe some assessments we would give him. We just are looking for the diagnosis. So when you start reading these kind of longer scenarios, make sure you're reading very carefully and really picking out what is the scenario telling me. Don't add anything, don't assume anything about the scenario, especially with these diagnoses questions. When we're looking for the correct diagnosis, a lot of characteristics of disorders, they overlap. They overlap a lot, and so you really need to make sure that you're putting together all the pieces correctly to get the correct diagnosis and not just looking at one particular part of the case scenario. So the other thing that we can do too is look at the answer choices before we start reading, and that way you know kind of what maybe you would be looking for. So in this scenario, one thing to or some things to pay attention to are the patient's age. He's 43. Sometimes he loses his voice when he lectures. It's not all the time, it's just sometimes. He loses the ability to phonate in anything other than a breathy whisper. A breathy whisper is a breathy whisper. That doesn't mean that we have stridor. It doesn't mean that we have a strangled voice. It doesn't mean we're hoarse. It just means breathy whisper. Another clue to kind of look for, or in this scenario, is that he sounds robotic on these days. So he doesn't have a lot of variation in his pitch. And then after a period of rest, his voice returns to normal. So when he takes a break, his voice comes back. And these problems can come and go. So if you're familiar with these answer choices, myasthenia gravis will definitely jump out to you. But if not, we may need to compare and contrast some of the other incorrect options first before we get to C. So what we're going to be looking for is what is not consistent with the patient's complaints. Let's look at answer A, adductor spasmodic dysphonia. So that results from inappropriate closure of the vocal folds, and it's going to cause strained and strangled vocal quality. So if you think about the vocal folds coming together inappropriately, too much, at the wrong times, it's going to be really tight in there. We're going to sound strained and strangled. That's not really what our patient's complaining of. Answer B, laryngeal webs. So these are often webs of tissue that develop in the laryngeal area. So when you think about it, you can kind of picture what would a laryngeal web look like. Okay, well, it's going to block the airway. Even if you don't know exactly what a laryngeal web is, you know that if there's some tissue in there, it's going to block the airway. What's that going to result in? That's going to result in shortness of breath, stridor upon inhalation. So we're going to be able to hear the person inhaling, which is not something that typically we can hear. So that's not really consistent with our patient's complaints either. Answer D, presbyphonia. That's age-related changes in the vocal folds that result in voice changes. If we look at the patient's age, he's 43. Presbyphonia doesn't typically start to impact people until 60, even afterwards. So age-wise, he doesn't really fit that category. Also, his symptoms aren't really consistent with presbyphonia. The symptoms typically are weak and breathy voice, which maybe we could say, kind of fits with him. Hoarseness, that's a really big one. That's kind of a hallmark characteristic. He's not hoarse. He has a breathy vocal quality and comes and goes, but we're not hoarse. Decreased vocal volume, you could say, a weak, breathy voice kind of fits in there. But diplophonia, he doesn't exhibit two different pitches when he's talking. So that's kind of how we can roll out all of those other answers. The other thing too, with these kind of longer scenarios, especially if you've been working with a lot of people maybe, or you've been maybe in a clinic setting and you've had a lot of experience, your experience can definitely bias you when you're answering these questions. So the first time I read this question, I was, editing and just kind of making sure everything was great. And my brain first went to muscle tension dysphonia. That's just kind of something that I've worked a lot with. It's something that, a lot of people have varying symptoms. And so this person, if muscle tension dysphonia was an answer, I probably would have selected that. Maybe, I don't know, probably it would have been a contender at least. But by looking at the answer choices, then I know it's not even muscle tension dysphonia. So looking at the answer choices can just give you kind of a way to, remove some of those biases that you do have from your practice and just from some of your experience. Now, we don't want to remove all of our, all of our experience. That's a good thing for the praxis. But just make sure that sometimes your experience can definitely influence how you might answer some of these questions.
Thank you, Tess. We provided the second question on the screen. Tess, could you tell us a little bit more about that question?
Yep, so this question, we are looking at another application-based question. But we're also looking at an application-based question that's asking us about multiple areas of speech-language pathology. So you need to apply your knowledge of various assessment procedures and also the characteristics of childhood apraxia of speech. So those are kind of the two areas that we're looking at in this question. And so answer B is going to be correct. The SLP should complete a hearing screening and oral motor evaluation, motor speech assessment, language evaluation, and articulation assessment. Those are all the things that you would need to do in this scenario. So kind of breaking this question down a little bit, one thing that makes this maybe a little bit more difficult of a question to answer would be that all of the answers are long. There's many different pieces to each answer choice and they're long. And so you have to evaluate each part individually. So even if one part of the question is correct, if the other part of the question or the answer is incorrect, you can eliminate that. So when we're looking at the answer choices, answer A, the SLP should complete a hearing screening, oral motor evaluation, motor speech assessment, articulation assessment. A language evaluation may be excessive since children with apraxia of speech typically do not present with language disorders. Okay, well, the first part of that question is correct. We know that we should complete a hearing screening, oral motor, all these different parts of assessment. But the second part of the question is incorrect. Childhood apraxia of speech does not just affect motor planning. There are children with childhood apraxia of speech that do have language delays. They have language disorders. Children with apraxia of speech are more likely to have language disorders. So it's definitely something we need to do. We definitely need to evaluate for language. It is, I would say, unethical to not evaluate for language because we know those children are they are at higher risk of language disorder. So we need to look at the whole child, not just at what we suspect is the main problem. Answer B, it is a good answer. The first and second parts of answer B are accurate and true. The first part lists the necessary components of evaluation, and the second part states that we should complete all elements of assessment to provide a comprehensive evaluation of the child's skills. So that one's correct, but we still should go through the other answer choices just to make sure. Option C, the second part of that question or that answer says a hearing screen is likely unnecessary since the child appears to have apraxia of speech. Okay, well, just basic fundamental speech language pathology practice. We should always be doing a hearing screening on any child, with whether they have a voice disorder, whether they have a language disorder, or suspecting a speech sound disorder. We should always be doing a hearing screen because you don't know. You don't know if their speech and language skills and their deficits are the result of a hearing impairment. So that's why that answer is incorrect. Option D, so well, I'll just kind of read. Well, the first part is correct. We've kind of read through that one. All the assessment components are there. The second part of this answer choice, though, a standardized assessment of articulation is unnecessary because the SLP can draw the same conclusions about the child's articulation from the motor speech assessment. Okay, well, that's false. We know a standardized articulation assessment provides additional information that a motor speech assessment is not going to provide to us. So a motor speech assessment evaluates the child's motor programming for particular movements, not necessarily specific speech sounds. So we need to do both. One thing that also to pay attention to with these longer answer choices, especially with some of these assessment components, make sure that you understand what the answer choices are saying. And what I mean by that is a lot of times motor speech assessment, oral motor exam, oral mechanism exam, cranial nerve exam, these are all assessments. They're all very different assessments, but sometimes in our practice, depending on who your supervisor is or your setting, your facility, they may use those names interchangeably, even though they mean very different things. It's not often that happens at facilities, but I've worked at facilities where an oral motor exam, we also include information about a cranial nerve exam, but we don't call it a cranial nerve exam. We just list out the components under the header oral motor exam. So you need to really make sure that you understand what those different components are before you answer a question like this, and don't use your past experience necessarily to provide you with the answer, because you could be given, you could be lumping some terms together that professionals do in the real world, in real practice. That the praxis, we shouldn't be doing. We need to make sure all the things are very specific and particular. Again, so on this, just make sure to read carefully, consider each option, and don't rush because you have plenty of time to answer.
Perfect. Thank you, Tess. We've provided the third question on the screen. Can you tell us a little bit more about this question?
All right, so looking at this question, the correct answer is option D. Refer the child for an audiological evaluation to determine if she has a hearing impairment contributing to the impaired resonance. So here's another application-based question. And what we need to kind of look for, the key information in this case, the words, the phrases that are important are suspected resonance disorder and fails the hearing screening. So suspected resonance disorder, we don't know that she has a resonance disorder. It's just suspected. She fails the hearing screen. So then the question asks us to make a decision. And although this item sets the scene by describing an evaluation of a suspected resonance disorder, it's ultimately requiring us to correctly apply a specific piece of knowledge about hearing screens. So looking at this question, one thing that definitely helps is imagining that this person is a real client of yours. If you had a real client come to you and this was the outcome of the hearing screening, one thing that you would definitely need to do is refer the child for audiological evaluation. A failed hearing screening does not mean that they have a hearing impairment. Maybe they woke up one day and, they weren't feeling their best and they just didn't answer appropriately. Maybe they, have a lot of fluid in their ear that day. That's not typical for them. So we definitely need to refer for an audiological evaluation, which I think a lot of people will definitely agree with that one. That's easy to kind of pick out. The next thing, that we kind of need to consider with these other answer choices, like answer A, develop a treatment plan for the child's impaired resonance and refer the child for audiological evaluation. Okay, well, this one's talking about us referring for audiological evaluation. That checks the box for sure. But if you had a child that came to you with these results, you would not develop a treatment plan for this child because you don't know why they have impaired resonance. They could have impaired resonance because they, maybe they do have a hearing impairment, or maybe they have a voice disorder, or maybe they have a structural abnormality. You're not really sure at this point in the case scenario. So developing a treatment plan for this child is not appropriate. It's not an appropriate step at this point. Answer B, explain to the child's parents that her hearing impairment makes it difficult for her to self-monitor. That is true. And that's, maybe that's true. That's not incorrect information to give a parent, potentially, although you don't know if she has a hearing impairment. We don't really want to tell parents your child has a hearing impairment if we don't really know. So I would say generally that's good information, but we wouldn't want to tell a child's parent who, we're not sure if they have a hearing impairment. We probably wouldn't, we still wouldn't be recommending speech therapy because, like in answer A, we don't know why they failed the hearing screening. And as a speech language pathologist, recommending hearing aids is not part of your scope of practice. One thing that you can do if parents have questions about, audiological evaluation, you can tell them that hearing aids may be appropriate. You could tell them, an audiologist might recommend them, but you still don't know. So we wouldn't recommend speech therapy or hearing aids at this point. Answer C, same reason. We could tell the parents that speech therapy is not indicated at this point. That's true. But it's not true that the child has to be fitted for hearing aids first. We don't know. We're not the experts in audiology. Our audiologist counterparts are. So we don't want to tell people, oh, well, when they get fitted for hearing aids or when they get a cochlear implant or when this and this and this happens, if they haven't been evaluated, we just don't know. So this is a scenario definitely helps to envision the child, envision the parent, envision what you could tell a parent, ethically envision what you might be thinking in that scenario.
Thank you, Tess. We've provided the fourth and final question for this video on the screen. Tess, can you tell us a little bit more about this question?
Yep, so this question is a just basic recall question. We're asking, or we're looking to find the cause of sensory neural hearing loss. And so the answer is B, auditory nerve. There's damage to the auditory nerve, we're going to end up with sensory neural hearing loss. So this question is a recall question about etiology. You're going to have to remember and recognize a lot of information on the praxis. So this is probably a question that a lot of you answered it very quickly. If you didn't answer it very quickly, I would go back through and kind of memorize some of these definitions, definitely some of these anatomical structures and how they relate to hearing so that you can remember, recall, and answer them quickly. But in this question, what we need to do in particular is we need to know the difference between sensory neural hearing loss and conductive hearing loss. So sensory neural hearing loss is caused by damage to the auditory nerve or the inner ear. So that's why answer B is correct, because that's what causes sensory neural hearing loss. A good way to remember sensory neural hearing loss, neural, nerve, auditory nerve. So, kind of using some of those mnemonic devices will kind of help you with some of those recall questions. Conductive hearing loss is caused by problems with the outer ear or the middle ear. So the external auditory canal, external auditory meatus, connects the outer ear to the middle ear, and the pinna is the visible portion of the outer ear. So if you had damage to these portions of the ear, you would have conductive hearing loss. So these are the areas where I kind of like to think of it, especially with hearing anatomy, ear anatomy. This is kind of the funnel. Your ear's the funnel. The external auditory canal, that's funneling everything to the nerve. If something's wrong with the funnel, the information from sound is not going to be conducted through the ear. So just kind of thinking about different ways to, think about some of these words. Give yourself a visual in your head that will help you remember some of these, really important things that we need to know. So also, kind of looking at this question, just a couple things I want to reinforce before we end our video. Definitely, if you're not totally sure about a question, make a guess. Read the answers, read the questions again, take your time, but make a guess. You're not going to lose points because you made an incorrect guess, like the SAT or the ACT. You're not going to get minus points for answering. So answer every question. If you're uncertain of the answer you selected, mark the item for later review and then keep going. On the Praxis, you get to mark it, and then at the very end, it'll show you like a review page, and you can click the numbers that you want to go back to. So you can automatically jump back to the question that you had marked. You don't have to sort through all of them. And then lastly, answer all the questions in order. Don't jump around. Always go in order, because when you kind of get to the end, you want to have everything answered and marked for later review, so you can kind of jump back and forth. You don't really want to get to the end and then have to go back and answer another question. I don't know. It's just answer them all in order. It'll make your life a lot easier.
That concludes today's video. We hope that you found it helpful and that you'll join us in the future for the rest of the series. If you haven't yet viewed the first two videos in the series, we encourage you to check them out. We provide links to these videos on the website. We wish you the very best as you prepare for the Praxis.